my name is Megan Pa, and I'm the owner and founder of Amphiba Baby. Today we're going to talk about the 12 benefits of baby wearing. There are more, but we're going to focus on these 12. When I was first having my son, I was really young. I was 26, full of energy, but joke was on me because so was my baby. And he would use his energy to cry for at least 3 hours every night. And I would end up walking the halls, just like patting his butt and shaking him and you know, like all the mom things. So my arms got super sore, my back got super sore, and I was like, this is not sustainable, I gotta do something. So I ended up discovering Babywearing. Today, we're going to talk to Rebecca Henders. She is a Pediatric Nurse Practitioner about the benefits of baby wearing. So Rebecca also has 2 little boys herself. She has a brand new baby. Tell me, how do you manage it all? How do you manage being a mom, working? Do you baby wear at home? Just share with us. What are your tips?
Yes, so managing it at home, I just take it one day at a time because it's a lot. And ask for help a lot. We have family in areas, so that helps a lot. But baby wearing has been invaluable, especially with my second, because my first, he's 3 and he's got lots of energy like your first, and so I'm constantly running around with him, and it gets tiring if you're trying to lug a baby around. And so baby wearing has been invaluable for me. So when we're at the playground or just trying to make him lunch, and I'll have my second in the carrier, and it just makes things so much more convenient. For sure.
Yep. So I'm wondering, do you have patients that come in and ask you about baby wearing? Do they come in already baby wearing? Is that something that you see a lot now?
Yes, I feel like I'm seeing it increasingly. So the one that sticks in my mind is a few years ago I saw a mom of twins, and the twins were walking by that time, but she came in baby wearing both of them, and I was like, that is
what a champion,
amazing and ingenious though, because you have 2 little kids that you're trying to chase around, and then to be able to kind of keep them contained and move from one place to another. I found that very
and they were close to a year. In my head I'm thinking, what a strong mama.
Exactly.
You know what I mean?
Like, that's a lot of weight.
That's a lot of weight. That's muscles right there. I love it. Very cool.
Yes.
Okay.
Yes.
So it's definitely something that's becoming more popular, so that's great you're seeing it with your patients. Now that you're seeing it with your patients, do you feel like there was a particular benefit that you are very drawn to with yourself or with them? That, like me with the less crying, that was my main focus. Is there something is that one for you, or is it something else?
I would say for me personally, I think the convenience of having being able to hold the baby and then still doing things with my hands is very important for my particular situation. But for my patients, I would say I get a lot of newborns that are in that 6-week, 4 to 6 week age range, and the parents are concerned because they're fussy or they're feeding all the time, or maybe not feeding well, and I can see baby wearing being a huge benefit to them, because they wonder what can I do, and there's not a ton you can do from a medical standpoint, because they're in growth spurts and they're having a lot of brain growth, and so crying can be a result of that, but I think that baby wearing can be a very easy and convenient option for them, and give them a little sanity, especially during that time frame. So.
Now that you're seeing it with your patients, is there any, and there's more research being done on it, is there any kind of talk among other medical professionals about baby wearing and the benefits of it, and something that between professionals do you think that it's beneficial to even bring to the attention of your other patients that may not know of it yet?
Yes, I would say that in school it's not something that was really emphasized. I didn't really have a lot of knowledge, or they didn't really emphasize studies on that, but I've been very compelled, recently, and then especially in my own personal experience with the benefits. And one thing I think that could be helpful, that I think is underutilized, is we have babies that are solely breastfed that maybe are not growing as well as they should. And so seeing how baby wearing can impact weight gain and affect effectiveness at breastfeeding.
Yeah.
I think it could be really important, because otherwise we're telling moms like, okay, well, pump or fortify your formula, and those things are so much more difficult and not as natural. And so being able to continue to promote breastfeeding, but then also help with
weight gain,
better weight gain, I think that could be utilized by the medical community more than it has been currently.
That's a really good point. I love that. I kind of want to piggyback on that a little bit, just because when you have your baby in a carrier, the availability and the proximity of baby to breast is something that encourages more frequent nursing, so that, again, it promotes that weight gain is what we're saying. And because a lot of times nowadays in our society, we have taught parents to feed their infants on a schedule, and that can be a little bit detrimental when we are working with patients that are nursing moms and babies, when really we need to be feeding baby on demand and following cues. And just being able to have the baby in that proximity, recognizing those cues right away, and then meeting those needs immediately. It's just like the perfect recipe to, promote growth, promote healthy babies. And not only does it help with the breastfeeding short term, but it helps in the long run. So like, these are moms that are actually, let's say their goal was to get to 3 months. They're hitting that goal or going past it. So that's another thing that I love about Babywearing. So, that's really great. I'm glad to hear that you guys are kind of talking about it. It may not be taught in schools yet, but it's something that medical professionals are aware of now. And I would be remiss if I didn't ask you one final question. And outside of Babywearing, if you were going to give a tip to any of your expectant parents or parents that have had new babies, what would it be?
I would guess I think it would be something kind of general, that I think that there's a lot of tips and a lot of noise about like how to care for your baby best, whether it would be feeding or sleep or whatever, and obviously there are some safety recommendations that you do want to follow, but like there's a lot of different ways to do things, and I think that finding your stride, finding what works for you and for your baby, and sticking with that is really important, and kind of helps you to focus on you as the mom or the dad's kind of mental and physical well-being, and that's going to make you the best parent for your baby.
Just taking in your advice and then doing what works for you and your family is beautiful advice. I love that. Thank you so much, Rebecca. And where can we find you?
So you can find me, I work at the Pediatric Group, or TPG Pediatrics, and our website is www.tpg-pc.com.
Perfect. Thank you so much. I'm so glad that you joined us today. Oh my God. There you guys have it. So it's Babywearing from a Pediatric Nurse Practitioner. And if you guys like this video, if you would like to see more how-tos and more interviews, hit that like and subscribe button, and you can also come and see what we've got to offer on our website. So that's www.amphibababy.com. Thanks. Take care, guys, and happy baby wearing.